Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Sayyid Farhad Ali with you. Today I'm going to talk about the MRI brain, and I will cover the indications, the contraindications, the patient positioning and planning for MRI brain. Let's start from the indication. The indications means if a patient comes with any of the following disease, then we will go for the MRI brain. I will shed lights on the names of the disease and will explain in the next slide in detail. The indications for the MRI brain is transient ischemic attack, cerebrovascular attack or accident, infection, inflammation, meningitis, encephalitis, HIV, AIDS, tuberculosis, cognitive decline, neurodegenerative disorders, dementia, demyelinating diseases, multiple sclerosis, loss of consciousness, seizures, epilepsy, brain tumor, metastasis, abscess, cerebral lesion, brainstem lesion, congenital abnormalities, post-operative follow-up, vascular pathologies, headache, and hemorrhage. Now let's discuss in detail. Let's start from the cerebrovascular accident. As from the name, it is clear that cerebro we are using for the brain, vascular to those blood vessels which are supplying oxygenated blood to the brain, and the arteries which are supplying oxygenated blood to the brain are cerebral arteries. Accident, any pathology come to this cerebral arteries, and the supply to the brain become cut off. So this is cerebrovascular accident. This is also called stroke. There are two types of stroke. One is a hemorrhagic stroke, other is ischemic stroke. In a hemorrhagic stroke, any of the cerebral artery will damage and the blood will go outside of the brain. So this is called hemorrhagic stroke. And in ischemic stroke, there will be no hemorrhage. There will be no blood outside to the brain parenchyma or the brain cells, but the blockage will occur in the cerebral arteries. Okay, here you can see this is these all arteries. You can see the course, but if you come here, the course is up to here, not so onward. This area there will be no supply of blood. If there is no supply of the blood to this area of the brain, this will be ischemic. So this is ischemic stroke, and this is the CT image, and this is the MRI image. Okay. Another is encephalitis. Start from the encephalitis. Encephalitis is inflammation of the brain. It is basically the inflammation of the brain that is usually caused by the infection or less commonly autoimmune reaction. Okay, it can lead to severe symptoms and complications. Usually it is caused by viral infection, and in viral infection I will give you some example like herpes simplex virus, HSV, enterovirus, influenza, measles, etc. Okay, and autoimmune reaction. What's mean by autoimmune reaction? An autoimmune system, when autoimmune system mistakenly attack the brain tissues, this is autoimmune reaction. Okay, and this you can see here in the images of the MRI, which shows encephalitis. Okay, here is bacterial encephalitis, bacteria like meningitis, but fungal encephalitis, it's very rare. Neurodegenerative disorder. Neurodegenerative disorders refers to a group of diseases that involves the progressive degeneration of the nervous system, particularly the brain cells, which is we are calling neuron. Examples are Alzheimer's disease and Parkinson's disease. If we come to the MRI images, this is a normal and healthy coronal image of the brain. Okay, and if we come to the other one, Alzheimer's disease, and Alzheimer's disease, it affects the temporal lobe, this is the temporal bone, and especially the hippocampus area. Okay, and atrophy of the hippocampus area is a main sign for the Alzheimer's disease. This is a normal, and you can see over here this is atrophy. So this is neurodegenerative disease, Parkinson. Other is the multiple sclerosis. So multiple sclerosis involves the degeneration or damage of the protective covering of the nerve fiber. The nerve fiber is covered normally by the myelin sheath. In the multiple sclerosis, the myelin sheets of the neuron are getting damaged. What is the function of the myelin sheet? So the myelin sheet helps nerve signals travel in a good way or in a faster way. But when there is a damage of the myelin sheath and the vascular and the multiple sclerosis, then the transmission of the impulses between the brain and the body will be slowed down or will be cut off. Okay, or there will be no supply of the signal. The supply of the signal will be blocked or it will slow down. So this is multiple sclerosis. If we come to the radiological appearance, this is the MRI flare. This is a flare image, MRI flare image. You can see here the hyper intense spot or the bright spots. This is a sign of the multiple sclerosis, and like the appearance of the hyper intense or bright spots mostly around the brain ventricles, hyper on T2 and flare on flare. This is hyper, and T2 also this will be hyper. Okay, and multiple sclerosis, the autoimmune system it's attack to its own healthy tissue mistakenly. So this is multiple sclerosis. Epilepsy is a chronic neurological disorder characterized by recurrent unprovoked seizure resulting from abnormal electrical activity in the brain. Okay, in epilepsy there will be abnormal electrical activity to the brain, and there will be unprovoked seizure. What's mean by unprovoked seizure? The seizures that happens without any obvious cause, like fever or low blood sugar or head injury. There will be no such cause, and the patient will feel seizures. This is called unprovoked seizure. The signs in the MRI will be hippocampus sclerosis, sclerotic areas in the hippocampus region. Okay, this you can see the hyper on the flare coronal and T2 coronal. This is sclerosis. So right side is sided temporal sclerosis, and most in hippocampus sclerosis is the most common cause of temporal lobe epilepsy. Okay, brain tumor. What's mean by tumor? Tumor is the uncontrollable or the extra growth of the cells, and if it come in the brain, then this is called brain tumor. You can see over here, this is a brain tumor. This is the brain normal cells, and this is the brain tumor. Okay, these all are the indications. Post-operative follow-up. If a patient is diagnosed case of the tumor and diagnosed by the MRI, so for the tumor, as we discussed previously, we will go for the MRI. Here the patient diagnosed of a tumor. After that, the surgeon performed the surgery, and after the surgery, the doctor advised post-operative MRI. Post-operative follow-up MRI. Why? Because to check how well the surgery went. The surgery went in a good way, or there is some complications after surgery, and also to monitor the healing or disease progression. Okay, this is post-operative follow-up MRI. Vascular pathologies. The vessels, the arteries which are supplying oxygenated blood to the brain are called cerebral arteries. If there is any abnormality in the vessels of the or in the cerebral arteries, this is vascular pathologies. And the vascular pathologies are coming because of it will affect the blood flow to the normal parenchyma of the brain. Okay, because there will be no blood supply to the brain, and or maybe bleeding or some vascular structural abnormality. This condition can cause serious issues like stroke, aneurysm, and hemorrhage. We discussed about stroke before, the hemorrhagic and ischemic, and aneurysm in the next slide. Hemorrhage. A brain hemorrhage is a bleeding in or around the brain. It is a form of stroke. Okay, hemorrhage is also a form of stroke and is caused by the high blood pressure, which we are calling hypertension, or aneurysm, and drug abuse and trauma. These are the causes.